Have you ever wondered what white cells do in our body? These microscopic warriors are our body's first line of defense against nasty invaders like bacteria, viruses, and other foreign substances. They are an integral part of our immune system, always ready to protect us from harm. There are 5 main types of white cells, each with a unique role to play. Neutrophils, the most abundant, are our body's rapid responders to infection. Lymphocytes, on the other hand, are involved in long-term immunity, remembering past invaders to mount a quick response in future encounters. Monocytes serve as our body's cleanup crew, removing dead or damaged cells. Eosinophils and basophils, though lesser in number, play crucial roles in fighting off parasitic infections and in allergic reactions respectively. Understanding these cells and their functions can help us comprehend how our bodies fight off diseases and infections. So, let's dive a little deeper into the world of white cells, shall we? Now, are you ready to delve deeper into the world of white cells? Let's start with our first type, neutrophils. These are the most abundant white cells in our blood, making up about 60% of the total. They're like the body's first responders, rushing to the scene of an infection, particularly bacterial ones, to engulf and destroy the invaders. Next, we have lymphocytes, which are the second most abundant white cells, accounting for about 30%. They come in 2 main types, B cells and T cells. B cells create antibodies, those tiny Y-shaped proteins that mark pathogens for destruction. T cells, on the other hand, directly destroy infected cells, and also help regulate other immune responses. Then, we have monocytes, which make up about 5 to 10% of our white cells. They're the body's cleanup crew. When there's inflammation or tissue damage, monocytes rush in, become macrophages, and start cleaning up dead cells and other debris. They also help stimulate other immune cells to join the fight. Eosinophils, though less common, have a very specific role. They make up about 1 to 3% of white cells and are primarily responsible for dealing with parasitic infections. They release toxic substances that kill these invaders. Additionally, eosinophils help regulate inflammation, particularly in allergic reactions and asthma. Finally, we have basophils, the least common type, making up less than 1% of white cells. They're involved in allergic reactions. When an allergen enters the body, basophils release histamines, causing the typical allergy symptoms like itching and inflammation. So, there you have it. 5 different types of white cells, each with their own unique role in keeping our bodies safe from harm. Neutrophils fight bacteria, lymphocytes create antibodies and destroy infected cells, monocytes clean up and stimulate other immune cells, eosinophils combat parasites and regulate inflammation, and basophils deal with allergens. Each white cell has a unique role. Working together, they form an efficient defense system for our body. How do these white cells react when faced with diseases? Well, each type of white cell responds uniquely to different disease states, and this can significantly influence their count and function. Let's start with bacterial infections. They commonly trigger an increase in neutrophils, the most abundant type of white cells. These tiny soldiers of our immune system rush to the infection site, engulf the invading bacteria, and neutralize them. However, a persistently high neutrophil count might hint at an ongoing battle against a severe bacterial infection or other conditions like inflammation or cancer. Moving on to viral infections, we see a different story. These invaders often cause a rise in lymphocytes, another type of white cell. Lymphocytes, including B cells and T cells, have a crucial role in our body's adaptive immune response. They identify the virus, remember it, and launch a targeted attack. In a chronic viral infection such as HIV, the persistent elevation of lymphocytes could lead to their exhaustion and subsequently a weakened immune response. Last but not least, let's talk about allergic reactions. When you're allergic to something, your body perceives it as a threat, even if it's just a harmless pollen grain. In response, your white cell count may change, with an increase in eosinophils and basophils. These cells play a significant role in allergic reactions and inflammation. They release histamine and other chemicals that cause typical allergy symptoms. However, a chronic elevation of these cells could indicate an ongoing allergic response or a more serious condition, like an autoimmune disorder or certain types of cancer. So, you see, the change in white cell counts is not random. They can often give clues about the type of diseases or disorders our body is fighting. In the next scene, we'll delve into some common disorders that specifically affect these white cells. For now, remember this. The change in white cell counts can often give clues about the type of diseases or disorders our body is fighting. What happens when these white cells don't function as they should? Let's dive into the world of white cell disorders. One of the most common disorders affecting white cells is leukemia. This is a type of cancer that leads to the overproduction of white cells, specifically leukocytes, inside our bone marrow. Instead of protecting our bodies, these cells multiply uncontrollably and begin to crowd out the healthy cells. This can lead to a weakened immune system, making the body more susceptible to infections and diseases. Then there's neutropenia, a condition where the body doesn't have enough neutrophils, a type of white cell. Neutrophils are like the first responders of our immune system, rushing to the site of infection or injury to fight off harmful pathogens. When the neutrophil count is low, the body loses a crucial line of defense, leading to an increased risk of severe infections. Both leukemia and neutropenia are stark examples of the havoc that white cell disorders can wreak on our health. But what causes these disorders? Well, it often comes down to problems with granulopoiesis, monocytopoiesis, and lymphopoiesis. The processes our bodies use to produce granulocytes, monocytes, and lymphocytes respectively. In the case of leukemia, for instance, an error in the DNA of a single cell during granulopoiesis can set off a chain reaction, leading to the overproduction of white cells. With neutropenia, on the other hand, the issue might be a disruption in the maturation process of neutrophils, often due to factors like radiation therapy or certain medications. Chronic diseases can also play a significant role in white cell disorders. Conditions like rheumatoid arthritis or lupus can cause inflammation that disrupts normal cell production, leading to an imbalance in the white cell count. In essence, our white cells are a crucial part of our immune system, defending us from harmful invaders. However, when these cells don't function as they should, it can lead to serious health complications. That's why understanding these disorders is so critical, as it can help us develop more effective treatments and interventions. A malfunction in our white cell production can lead to serious health issues. How can we detect and treat these white cell disorders, you may ask? Well, the process begins with diagnosis, typically initiated by a blood test. A complete blood count, or CBC, is a common type of blood test that can give us crucial information about the numbers and types of cells in the blood, including white cells. If the results show an abnormal white cell count, it may be indicative of an underlying disorder. Further tests may be required to pinpoint the exact type of white cell disorder. For instance, a blood smear allows doctors to examine the white cells under a microscope, gaining insights into their appearance and numbers. Additionally, a bone marrow biopsy might be performed to observe the processes of granulopoiesis, monocytopoiesis, and lymphopoiesis directly. Once a diagnosis is established, the treatment plan is tailored to the specific condition and the patient's overall health status. Medication is often the first line of treatment. For instance, corticosteroids may be used to decrease inflammation and suppress an overactive immune response, while antibiotics can help fight bacterial infections. In more severe cases, radiation therapy might be employed. This involves using high-energy radiation to kill off abnormal cells, slowing or stopping the progression of the disorder. It's a potent tool, but it's not without its side effects, which can include fatigue and skin changes. Lastly, stem cell transplants may be considered, especially for conditions like leukemia. This procedure involves replacing the patient's diseased bone marrow, the source of white cells, with healthy stem cells that can regenerate and produce normal white cells. But remember, every patient's journey is unique. What works for one might not work for another. The key is to work closely with healthcare professionals who can guide the process, adjusting the treatment plan as necessary. Timely diagnosis and treatment can help manage white cell disorders and prevent complications. So don't underestimate the power of a simple blood test. It could be the first step towards understanding and controlling a white cell disorder, potentially saving a life. So, what did we learn about white cells today? We discovered the fascinating world of white cells, those microscopic warriors that tirelessly defend our bodies. We dove deep into the different types of white cells, from granulocytes, monocytes to lymphocytes, each with unique characteristics and functions. We explored how these cells can be impacted by various diseases and the disorders that can affect them. We learned that malfunctions in granulopoiesis, monocytopoiesis, and lymphopoiesis could contribute to disease states and white cell disorders. We delved into the analysis of blood results, unfolding the story that numbers and ratios can tell us about our health. We also touched on how chronic disease states may contribute to white cell disorders, highlighting the importance of early diagnosis and effective treatment. Understanding white cells is crucial to understanding our body's defense mechanism. The more we know, the better we can take care of our health.